I'm excited because this is a huge, huge event for our community, knowing that we are going to save lives with this expansion and continue to meet the needs of a growing population for decades to come.
It's extremely exciting for me. I've seen it kind of grow over 7 years, and so to be able to provide that to the community when I know that the community needed this level of care for so long, and being part of that growth has been extremely gratifying.
Well, today is a huge celebration for Summit Pacific. I mean, this represents a huge investment in the local community and job opportunities, as well as healthcare expansion for vital services that the community needs. But also just them being able to step into that commercial bond market speaks so highly to their leadership and their sustainability for the future. That's worth celebrating.
Summit Pacific Medical Center's expansion will significantly improve healthcare access by doubling acute care beds from 10 to 20 and expanding the emergency department to include more exam, triage, and trauma rooms.
Critical Access Hospital is essentially a hospital in a rural setting where access to healthcare is very limited, resources are limited. So it can be challenging, especially when there is higher acuity of patients, more pathology in the community, meaning patients are sicker.
Rural hospitals are asked more than ever to keep sicker patients here in our hospital. And we've been doing that consistently for the last 3 years that I've been here. That ask comes at a price. So our staff have had to learn higher acuity, but our space is our biggest constraint. We don't have the space to keep those patients here longer. With that, we're rising the occasion and doing what our community says they need.
With the expansion, it'll allow us to see more patients in an expedited way, and with that, indirectly, we increase our service lines. So for example, we would have MRI services 24/7, and that allows us to keep our patients in the community rather than transferring them outside of the county.
I think that's the reason why I'm so excited is, this whole journey has been with a focus of keeping the tax off the community. As a public hospital district, we can go out and tax our residents, which most hospitals, that's how they expand their services. And we elected not to, and that's what made this so hard and so complex, which is we went through a unique way of finding revenue bonds and becoming S&P bond rated, which then keeps the debt off the taxpayer. And we were able to leverage just our position, our health and financial stability and viability as a hospital to do this.
Thank God. Congratulations.
Financing can be kind of a dry, dull topic for some people, but it's how we get things done in this society. And this community has really come together to position themselves well under this leadership for the future.
The transformation of Summit that I have seen in the past few years, it's exponentially grown, and the need for the community has grown. We've done the best to provide what we can, but resources have been so limited. But with this expansion, I feel like we're going to continue to grow and provide more and more services that the community